7 Steps to Healthy Pregnancy. Number 1. Get early prenatal care. Good prenatal care is essential for you and your baby. Call your healthcare provider right away and schedule your first prenatal visit. During that visit, you'll be screened for certain conditions that could lead to complications. If you haven't yet chosen a provider, get started now. Finding the right person, whether you're looking for a doctor or a midwife, can take a while. In the meantime, let your current caregiver know if you're taking medication or have any medical concerns. Number 2. Watch what you eat. Now that you're eating for 2, you may be surprised to learn that you only need about 300 additional calories per day. Make sure you get plenty of protein. You now need 70 grams a day compared to 45 grams before you got pregnant. And while your calcium requirement remains the same, it's more important than ever that you meet it, which is a challenge for many women. You'll want to steer clear of undercooked eggs and meat, unpasteurized dairy products and juices, raw seafood, and cold deli meats to avoid ingesting bacteria that could harm your baby. Also avoid certain fish that may contain high levels of mercury or other contaminants. Number 3. Take prenatal vitamins. Most prenatal supplements contain more folic acid and iron than you'll find in a standard multivitamin. It's important to get enough folic acid before conception and during early pregnancy. Folic acid greatly reduces your baby's risk of developing neural tube birth defects such as spina bifida. Ideally, you should start taking 400 micrograms of folic acid at least 1 month before becoming pregnant. Once your pregnancy is confirmed, up your daily dose to 600 micrograms. You also need to make sure you're getting enough iron. Your iron requirement increases significantly during pregnancy, especially during the 2nd and 3rd trimesters. But more is not necessarily better. Taking too much of certain things can actually be harmful. Avoid megadoses of any vitamin, and don't take any additional supplements or herbal preparations without your caregiver's okay. Number 4. Exercise regularly. A good exercise program can give you the strength and endurance you'll need to carry the weight you gain during pregnancy, help prevent ovaries aches and pains, improve sluggish circulation in your legs, and help you handle the physical stress of labor. It will also make getting back into shape after your baby is born much easier. What's more, exercise is a great way to reduce stress, and some research suggests that staying active can boost your level of serotonin, a brain chemical linked to mood. Just remember not to push yourself too hard or let yourself get overheated or dehydrated. You'll also need to avoid hot tubs and saunas while you're pregnant. Number 5. Get some rest. The fatigue you feel in the 1st and 3rd trimesters is your body's way of telling you to slow down. So listen up and take it easy as much as you can. If you can't swing a nap in the middle of the day, give yourself a break and let your other responsibilities slide a little. If you can't sleep, at least put your feet up and read a book or leaf through a magazine. Relaxation techniques such as yoga, stretching, deep breathing, and massage are all great ways to combat stress and get a better night's sleep. Number 6. Just say no to alcohol. Don't drink while you're pregnant. Any alcohol you drink reaches your baby rapidly through your bloodstream, crossing the placenta, and your baby can end up with higher levels of blood alcohol than you have. As little as 1 drink a day can increase your odds of having a low birth weight baby and increase your child's risk for problems with learning, speech, attention span, language, and hyperactivity. And some research has shown that expectant moms who have as little as 1 drink a week are more likely than non-drinkers to have children who later exhibit aggressive and delinquent behavior. Number 7. Stop smoking. Smoking increases the risk of miscarriage, growth problems, placental abruption, and premature delivery. Some research has even linked smoking to an increased risk of having a baby with a cleft lip or palate. Number 8. Cut back on caffeine. The March of Dimes advises women to limit their caffeine consumption intake to less than 200 mg per day, an amount you could get from 1 8-ounce cup of strong coffee. What's more, caffeine has no nutritive value and makes it harder for your body to absorb iron, something pregnant women are already low on. It's also a stimulant, so it can make it even harder for you to get a good night's sleep, give you headaches, and contribute to heartburn. Number 9. Eliminate environmental dangers. Some jobs can be hazardous to you and your developing baby. Keep in mind that some cleaning products, pesticides, solvents, and lead in drinking water from old pipes can also be harmful. Talk to your doctor or midwife about what your daily routine involves, so you can come up with ways to avoid or eliminate hazards in your home and workplace. Number 10. See your dentist. Don't forget about your oral health. Brush, floss, and get regular dental care. Hormonal shifts during pregnancy can make you more susceptible to gum disease. Increased progesterone and estrogen levels can cause the gums to react differently to the bacteria in plaque, resulting in swollen, bleeding, tender gums, gingivitis. So see your dentist for a checkup and cleaning now if you haven't had a visit in the last 6 months.